Hi guys, welcome to our channel.
So guys, January is Cervical Cancer Awareness Month.
Yes.
And there's been a lot of information going around.
About cervical cancer.
Yes, and people are getting informed. There's also a lot of information about the HPV vaccine, which is available in the country going around. And so, what better way to end the month other than talk about it?
Yes, and
So,
if you know us well, you know we love women. Being young women, we always try to make sure that women out there are educated, and cervical cancer is an upcoming thing that we feel like everyone should be aware of, especially with regards to the vaccine, blah blah blah. Yeah.
Yes. So we're very passionate about women, as she said, and cervical cancer is the second leading cause of death in the country among women.
Yes.
And so in that case, all the information you can get about cervical cancer, grab it and run with it.
Exactly.
So for starters, have you treated a woman with cervical cancer?
Yes. Okay, I wouldn't say treated, but
Involved in management?
I have been involved in the management of someone with cervical cancer. And guys, let me tell you, it was just wow. That's all I can say. It was just wow.
Terrible.
It was terrible. Yeah, from just the way they were presenting to how much distress they were in, and just seeing the progression of that disease from the way it started, like their story from how it started to where they were at that moment. It was just, wow, it was horrific, honestly.
True. So we've encountered women with cervical cancer from an outpatient setting and as well as an inpatient setting. So the one who stuck with me was at the terminal stage. She was really ill, her HB was really down, she was in and out of hospital for a while, and at that point there's nothing that could be done, so we just had to transfuse her. So one of the things cervical cancer does to you is, and cancer in general, it kills your hemogram level. How do I say it?
Like it suppresses your bone marrow in general, so you find that your blood level is low, your ability to fight infections is also low, and things like that.
Yeah, so that lady was her HB level, so a normal HB level is around above 12. This woman, her HB level was 3. That is seriously low.
Yeah.
Yeah.
And for some reason, most of the time when women present to hospital, it's usually in the later stages. I don't know why. I feel like there's a lot of fear when it comes to gynecological problems. So you'll find that someone started experiencing these symptoms a long time ago, but because of just that fear of nobody wants their nether areas to have any issues. So when you get such issues, you just are afraid to go and seek help. So even me, the one that I encountered was in their final stages, the one where literally there's nothing you can do. All you can do is just palliation, basically making her comfortable, controlling pain. And if there's any doctor out there who's encountered this, they can tell you it's just really horrifying.
And I think all doctors have.
Yes, I think all doctors have. So that's why it's just important to know how these symptoms begin and how they progress. So that in case you're having this issue, or in case you have someone who's experiencing these issues, then you can just tell them to seek medical advice, and just so that it can be found earlier.
Yes.
So what are some of the symptoms of cervical cancer?
So a woman with cervical cancer will come with bleeding. So first of all, if you're experiencing any symptoms, this is not treatment, this is not medical advice. We're just talking about cervical cancer in general.
Yes.
We can't diagnose anyone over the internet, and we can't treat anyone over the internet. You need to go see a doctor physically.
Yes.
Yeah, so someone will come with there's usually normal discharge, and generally
All women.
every woman knows what their normal
Discharge
discharge
is
looks
like, yes.
and discharge varies from during the menstrual cycle. Sometimes it's clear, sometimes it's different.
Yeah.
So, but if normal discharge does not have a bad smell to it,
Yeah.
it has a smell.
But it doesn't have a bad smell.
Yes, it's not bad. So if the smell is bad, then you're starting to think maybe something is wrong. If you're having pain while having coitus, then something is probably wrong. If you're bleeding, something is probably wrong. If you're having abdominal pain, so and with time, so you'll start having symptoms of now the complication
Of the disease, yes.
like you can start feeling dizzy because your blood levels are low. You can start becoming breathless, being tired. Just to list a few of how you can be feeling.
Yeah.
Yeah.
To add to the discharge bit, I know that's where most women are usually confused, you know. So because there's discharge that's related to like a yeast infection, there's discharge that's related to like bacterial vaginosis, you know, such things. But with cervical cancer, it has a clear progression. It starts as a clear discharge, and it does not stop there. Now it starts becoming thick, then it changes color, just to a weird color, and then it becomes very foul smelling. Like, if you experience such a discharge, you will know something is wrong because it smells really, really bad. So yeah, but like as she has said, those are some of the symptoms, and the bleeding part is like abnormal bleeding. By abnormal, I mean maybe you're bleeding way earlier than your usual menstrual period, or it's way after, or after sex you're experiencing bleeding, or during sex you're experiencing pain. It's not normal. Yes, so those are some of the symptoms.
Yes, so if you have any of those symptoms, you go see your doctor.
Don't be afraid.
Yes.
You'd rather go and get screened right now than come when it's like really late.
Yeah, so let's go into diagnosis.
Yes.
So
Okay, basically diagnosis has the usual parts, your signs and symptoms. Signs are the things you'll come and say, this is how I feel. Symptoms, sorry. Signs are what we look at you and see, like, okay, yeah, she has a mass here or a discharge here, yeah.
We're teaching you even medical terms.
Yes. So, and then after that now, there's the pap smear. That's the major thing that usually diagnoses cervical cancer. So during a pap smear, I don't know how many people have been screened for cervical cancer, but it's recommended that you go at least once every year to be screened, or at least once in a period of 3 years you have been screened for cervical cancer. So it's a pretty simple procedure. They just go, they sweep your cervix and get some cells. Then it's put under a specific stain that looks to see if your cells, or your cervical cells are normal, or if they have undergone some changes. Yeah. So that's what a pap smear entails. The other way is
I think you might be wondering how the procedure will be during a pap smear.
Yes.
So we use a speculum. A speculum is we'll put a photo here.
Yeah.
It's an instrument that is put through your vagina and then opened up to look at the cervix.
It usually looks like a duck's beak.
Yeah.
Side note. We'll put side by side photos so that you guys can see what exactly we mean. Yeah.
So traditionally the speculums were metallic, but now we are having plastic speculums,
yes,
which are one use.
Yeah, because the metal one, since it was metal and they were expensive, we used to use one.
Yeah.
But it's not that now they remove from one person and put it to you, no.
It's sterilized
Yes.
under very sterile conditions.
Yes, and extreme heat that will kill whatever sort of germs are there.
Yeah, so
but
it's
now,
very
yes, but now they're like plastic ones which are disposable. So
and they're not as cold as the metallic one. You know, the metal is just whatever temperature is there, it will acquire. So
yes,
they're not as cold, and then so it's a bit uncomfortable, but it's not painful.
Yeah.
It's not painful, and it's a quick procedure. It's
very quick.
2-5
Anything,
minutes.
yeah, 2-5 minutes, you're done. Then the other thing is HPV, human papilloma virus. It's a very key thing in the diagnosis of cervical cancer because it is what causes cervical cancer. And there are many strains of the HPV vaccine, not vaccine, of the virus, yeah? So if you're diagnosed with the HPV, then you are predisposed. You're highly likely to get cervical cancer. The other things are just like standard tests, like the full hemogram to check your blood level, to check if you have the level of your white cells. Then there's some other imaging modalities that we will not go into. But the two most common things is a pap smear and HPV screening.
Yeah, do you know when you should start doing a pap smear? Up to 21 years of age.
Yes. So, okay, literature is different. There are people who say initially it used to be like from 21 years, it was assumed that women from 21 years of age is when they start having sex, you know. But now women as early as 16, they're having sex, you know. And starting sexual intercourse at a young age is one of the risk factors for getting cervical cancer. So yeah, literature says that from the age of 21, you should start getting screened for it. But I would just say for anyone who's sexually active, you need to be screened.
So basically all of us at this age group should be getting pap smears every single year. It's better to catch it. So, you know, a pap smear, the good thing, it catches the cancer before it's cancer.
Exactly.
Yes, and it can be managed very easily initially because later it's painful, it's surgery, or it's nothing can be done.
By the way, I've realized we've just talked about, we moved to diagnosis without even talking about what are some of the things that put you at risk of getting cervical cancer. One of the things is what I have mentioned, early age at first sexual intercourse, having multiple sexual partners, or having a male partner who is promiscuous. Yes, those are some of the risk factors. Yeah.
So, can we go into the HPV vaccine, which is
Highly
having a lot of
controversial.
reactions in the country. People who are in charge are saying no, we don't want it. I don't get even how linked to immorality it is. Like seriously, explain to me.
By the way, let's
I have
not
time.
get into
I
that
have time.
because
Explain to me.
I never understand how, and most of the time you'll find that it's men who are like, no, it's associated with promiscuity. Why are you making decisions about women's bodies? You know, like you will not go through this. We go through this. So what gives you the right to make decisions about our bodies?
Yeah.
Anyway.
And so the HPV vaccines that are available usually are HPV 16 and 18, which are the most common culprits in causing cervical cancer. Of course, there are many others, and there are so many strains of HPV, but those ones are the most common. That's why it's advocated that women, girls, get the vaccine before they're sexually active, right?
Yeah.
Yes, before you contract the disease.
Yes.
However, it's available for women up to 45 years of age. So what
is keeping you from getting the
What are
vaccine?
you waiting for? Have you gotten the vaccine?
Well, I haven't yet. Look at me here being a hypocrite, but I plan on getting it soon. And also the two vaccines that are usually, the ones that I know of are Gardasil and Cervarix. So Gardasil protects you against 9 strains of the HPV, and then Cervarix I think is 6, or I'm not so sure how many it protects you from. But the commonly available one is Gardasil. So if you go to any hospital, you can get it.
Any public hospitals have it for free.
Yes.
Absolutely
And
free.
I know there's a lot of controversy, especially with recommending that young girls and boys should get vaccinated for HPV, but it is important. Why is it important? Because, let's be honest, young children, young girls, young boys are having sex like very early. So it's important for them to be vaccinated. And I know most people are thinking like, why boys? Because they are the carriers of the HPV vaccine, honestly. Most of them, you'll find that women get these infections from men. So it's important that they also get vaccinated so that they don't transmit it to their sexual partners and stuff like that.
So passionate about it.
I am, because I am passionate because I've gotten so many questions regarding this whole vaccine issue. And my understanding of it is people are just linking it to promiscuity and why do you want to expose our children to this kind of knowledge, and but I feel like it's just like it goes down to like understanding the fact that your children will go out there and they'll meet other children who have been exposed to this and this and this, because we don't all raise our children equally, so they'll go and get exposed to this and then they start having sex and they're not protected, because even some of these HPVs are not, a condom will not protect you from it, so guys,
Yeah, so that was a short video, but I think almost everything, if we haven't addressed any of your concerns or there's something we've left out, please let us know.
Yeah.
We'll cover it on stories.
Yes, we'll have a Q&A on our stories, then you can ask us any questions that you want.
Or you can leave a comment down below.
Yeah.
Yeah.
So, I don't know what's choking me.
Something like this might happen in one of our videos.
I know.
In all.
Anyway, like she has said, it's a very short video. We didn't really want to get into the whole biomechanics.
Yeah, because we don't want to bore you guys with things you don't want to listen to. So, if you want more information, we'll have more information for you guys. But it was really important that we cover this in January.
Yes. Yeah. So what are the take-home messages? Number one, you should be able to recognize the signs and symptoms of cervical cancer. Number two, it's important to seek treatment really early, so that if in case, so that you can catch it early. Number three, let's get vaccinated. Prevention is better than cure, honestly. You'd rather prevent yourself from getting it than now starting to struggle with, chemotherapy, radiotherapy, and surgeries, and, a lot of all that all those things that come with cervical cancer. The other thing is just be knowledgeable, and be open and be true to yourself and understand that you might be afraid now, but when you're sick, you will not be afraid.
Yeah,
that thing that you're afraid of now, it will happen to you twice as much when you're sick.
Yeah, for me, screening. Go for screening. Go for screening every year, just so we can catch it early. And then if you're afraid, as we have said before, you can always go and say, I don't want to see a male doctor, I want to see a female doctor. It's absolutely in your patient rights, it's even in the constitution anyway. And the procedure is actually your privacy is respected to the best of our ability. And yeah, we carry out these procedures with dignity. So that's our priority nowadays.
Yes, guys. So as usual, thank you so much for engaging with us and just watching our content. Honestly, of late we've been getting very good responses from you guys, and we're happy. It makes us feel good when we put content out there that you guys can relate to. So yeah, we as usual, we're very thankful. Like, share, subscribe, everything that you guys have been doing.
It's free. I hear that